Hi, this is Dr. Christopher Maloney. I want to tell you what a visit with me would be like. So if you come and see me, basically I'll be doing this with you a lot. I'll talk to you and then I'll ask you questions. I would say something like, well, so why are you here? You'd tell me, and I'd ask questions about that. And I'd say, what else is wrong? And you tell me, and I'd ask questions about that. We do that for about 20 minutes or 30 minutes, which is twice the length of a normal doctor's visit. At the end of that, you should run out of things to say, what's wrong with you? And then we start exploring those things. We start thinking about them, and I'll say, well, where did this start? Did someone else in your family have it? All of those kind of history questions. And we put together. But this may be the first time in your life that you're going to go through your entire medical history in a way that covers everything, in a way that kind of tries to tie things together. And then as soon as we're done with all of that, I'll tell you what I've heard you tell me, and I'll just repeat it back to you in many cases. And in many cases I'll say, do you know that you just told me that only occurs on a blue moon after you've had a fudge sundae? And in many cases patients are like, you're amazing, you've done this amazing thing. And I said, well, all I did was listen to you and repeat back what you've done. But many of my treatments with patients are based on all of this extensive history. So when patients say to me, what do you do for X? I'd say, well, it depends on who you are and what you've got. In many cases, my treatments are not simply a pill to swallow. You have to do something. And so, of course, it's incredibly individualized because I want you to be able to actually do what I need you to do. And so I may have a dozen different treatment plans, but you and I are going to come up with an idea of what's going to work for you. And we're going to write down 2 or 3 essential ideas before you leave about it, and then we'll probably have 1 or 2 other plans in the background if those aren't helpful. So people come in, they tell me their whole story, and then they hear back from me, kind of repeated back, and then kind of integrated into what I think is actually going on with them, and then we come up with a treatment plan together, and the whole thing takes about an hour and a half and 2 to 2 hours, and the process is extremely different from a standard visit where you're told, what is your acute illness? Let's fix your acute illness. That's what we're doing today. That's not what we're doing when you come to see me. What we're doing is we're going through the whole enchilada, taking it all apart, looking at the whole thing, and coming up with a plan that's going to last your whole life.